Taoiseach, on the 9th of November, my colleagues and I in the regional groups secured the unanimous support of this House for a motion on long COVID, seeking immediate action because of the impact that it's having on our health service. And that includes studies like the one published in the Irish Medical Journal in June of 2021 that found that long COVID had a significant impact on our health system, particularly in terms of increased demand for healthcare services, longer hospital stays and increased healthcare costs. Another study by researchers in Trinity College, published in the Lancet Respiratory Medicine Journal in September of 2021, estimated that up to 11% of individuals infected with COVID-19 in Ireland are likely to experience long COVID, which could lead to a significant burden on our healthcare system. Taoiseach, patients with long COVID, many of whom are young with no underlying health conditions, are presenting to our health services with prolonged multi-system symptoms that are impacting on their daily lives, affecting their ability to work and causing significant disability for some. Long COVID is also having a significant impact on our workforce. Long COVID is costing millions of euro in lost work and welfare alone. Data from the Department of Social Protection has shown that 0.8% of those who contracted COVID-19 and claimed the enhanced illness benefit payment were medically certified as being unfit to work 12 weeks later. If this was extrapolated across the total number of people infected with COVID-19 within the adult population, it equates to over 21,400 people. And the welfare data is also showing that 35% of workers on disability payments as a result of COVID are out of work for at least 6 months. The Taoiseach, our motion called for the designation of long COVID as an occupational illness for frontline workers who contracted the virus due to their employment. Long COVID being listed as an occupational illness would allow frontline workers to avail of long-term income assistance until they are fit to return to work. At present, only healthcare workers who are out sick prior to the 15th of November 2021, which was prior to the Omicron variant being detected, are able to avail of paid leave, which will cease in June of this year if they have not made a full recovery, which allows them to return to work. All other frontline workers, including healthcare workers out sick due to long COVID, contracted as a result of their work, are now excluded from any support from their employer. Now, Minister Humphreys has given a commitment to address this issue. She has written to Minister Coveney and Minister Donnelly looking to move on this issue. Minister Coveney has responded positively. She is still waiting a response from Minister Donnelly. Will you intervene, ensure that that response is forthcoming and address this issue?
First of all, I want to thank the Deputy and, if you don't mind me saying so, in the context of your recent announcement, to wish you the very best. Although you did very quickly say to me in the corridors that that wouldn't spare you from harassing me, politically speaking, for the next while, and you will be as robust as ever. I want to acknowledge your long-standing and consistent support of the long COVID issue, and I think very few deputies has put as much work into endeavouring to understand the issue, the prevalence of long COVID across the population, and then the consequences for individuals and families. So I appreciate that, and you've been arguing on the health side for quite some time. I think Minister Donnelly is primarily responsible for developing a national strategy and a national service for long COVID, which he's doing. 2.2 million was allocated for service development last year. That's now 6.6 million for 2023, and that's ensuring the provision of post-acute and long COVID clinics operating within each hospital group to ensure that there's a national service. And post-acute clinics are managing patients between 4 and 12 weeks after initial onset of infection, and long COVID clinics are managing patients 12 weeks post the onset of infection. And you know the list of the hospitals, I think, and the various things. I think what is important is that we really work on the research side and really endeavour to get a proper handle in terms of what are the longer-term implications. You focused on occupational illness today. You've had good responses from Minister Humphreys and Minister Coveney. As you know, the way government works, obviously this is an issue we will examine, okay? But fundamentally it will come to the estimates, and we've collective responsibility, and it will be an issue that we have to examine collectively, and obviously with our Ministers for Public Expenditure and Ministers for Finance. But I think you've made a reasonable case here, and I appreciate that, and we will work across government now to address this aspect of the long COVID issue. We have, I think, made significant progress on the health side in terms of provision of a wide range of facilities, including a tertiary neurocognitive clinic in St James's, led by a consultant neurologist and so forth. There'll be many multi-dimensional aspects to the long COVID issue that we'll have to deal with over the longer term. On the income side and the occupational illness side, I think you've identified an issue here that we have to come back to you on and that we are examining within government.
Thank you, Taoiseach. Can I say at the outset that the estimates is too far away, Taoiseach. There are many frontline workers that are getting no support from their employer at the moment or through the occupational system. And for some of those frontline healthcare workers, that money will run out next June. So money coming at the end of the year is no good. And as I say, Taoiseach, we're talking about, on a population basis, over 21,000 people who may be unfit to work due to long COVID. And that excludes people that have relapsed after initial recovery and many thousands more who are still in employment struggling with that illness. And the sad fact for many of these people is that trying to get access to care and treatment is nearly impossible. On average, they will wait 6 months to access a long COVID clinic, and if they happen to be unfortunately in Dublin, they will wait more than 12 months. And at the same time, the Mater Hospital long COVID clinic treating neurological conditions such as brain fog associated with long COVID closed down at the end of last year, forcing patients to travel abroad to get treatment. So my question to you, Taoiseach, is when will we have a fully functional long COVID clinic network across this country established?
As I said earlier, the national service has been rolled out with about 6.6 million allocated for 2023, and that is to provide post-acute and long COVID clinics. The long COVID clinics currently operational under the new model of care include St Vincent's University Hospital, Beaumont Hospital and University Hospital Galway, and the post-acute COVID clinics operational under the new model of care include University Hospital Galway, the Mater University Hospital and Connolly Hospital Blanchardstown. In addition, Tala University Hospital and St James's Hospital operating combined post-acute and long COVID clinics, and Cork University Hospital held its first dedicated long COVID and post-acute clinics for patients in December. The location of specific clinics, of course, will be a matter for the HSE as we roll this out. I've mentioned the tertiary neurocognitive clinic in St James's Hospital, led by a consultant neurologist with background in neurocognitive disorders. This clinic is accepting referrals from long COVID post-acute clinics around the country. And then in addition to the new clinics established and funded under the interim model of care, there are some additional hospitals which are operating long COVID clinics on an ad hoc basis. Recruitment has been very substantial to date. 66 people essentially have been recruited to those clinics, and resources have been provided for those, and about I think 34 have been recruited so far.
Thank you very much.